Are there any advanced equipment to improve the quality of the sperm or egg, ma'am?
Yeah, advanced techniques is DFI test, like DNA fragmentation index we can see. Like so this is a qualitative analysis of the sperm. Like semen analysis is a quantitative analysis and this is a qualitative analysis. So you are checking the any fragmentation, that is breakage of DNA in the sperm. Like many tests are there, like tunnel test, comet assay, or sperm chromatin structure assay, SE or sperm chromatin dispersion test. Mostly in fertility clinics we follow like sperm chromatin dispersion test. So with that we can find the amount of fragmentation of DNA, like the percentage of the fragmentation of the DNA, that it should not exceed 25%. Like 10% is ideal, is perfect, okay. And after that it is significantly we may get like we may not get the blast also.
So can we enhance the quality of the embryo or sperm?
To enhance the sperm, the quality of the sperms, like we have MAX, like magnetic assorted, activated cell sorting technique, and the Zymot, which works as microfluidics with the chip, which is rheotaxis and electrokinetic way, and SEPD, and many other like Pixie dish. This all will help in getting the good quality of the gamete. So they helps in different principle. I mean work in different principle, but all the ultimate goal is like to get the good quality of the sperm. So this is how we can improve the quality and we can get good embryo.
So we spoke about the fertility preservation. Yeah. So how did it vary from the cryopreservation technique?
It doesn't vary from the cryopreservation. Actually, it is also a cryopreservation technique. But the thing is like fertility preservation is main thing is like we used to collect it. There are few indications, like only this medical indications, career oriented, some those kind of thing we can do. But this cryopreservation is common to every patient who is undergoing IVF treatment. They will undergo for oocyte cryopreservation. Oocyte cryopreservation in the sense like suppose we are not getting the sample on the day 0, like we could not do any ICSI or IVF cycle. Sample is too poor. We got the sample but we could not get any sperms in that. So we'll be knowing, we'll be checking previously also the semen analysis will be done. But on that day, the patient husband may be very panicking, they could not collect something. We'll be having the frozen sample also. Suppose in some cases we could not get that. So in that cases and all, we'll go for oocyte cryopreservation. A patient will be asking for oocyte cryopreservation. And some patients who will be having poor ovarian reserve, they'll be collected with oocytes, they'll be injected. After the 1 or 2 oocyte collected, with that we will be getting embryos and we'll be preserving that. Then again the next cycle 1 oocyte if they get, we'll be retrieving it, we'll do ICSI, we'll make it as embryo. Then we'll pool this and we'll transfer those. In those conditions and all, cryopreservation is more helpful. So that plays a major role. And moreover, the cryopreservation cycles gives the better result nowadays, because there is alteration of the physiology at the natural cycle. So this gives the better result in the cryopreserved cycles.
So what are the specialities of Vijayawada Ferty9 branch, ma'am?
Speciality like Positive Hope and Dr. Suma ma'am and our embryology team, main thing. Next is our lab. It is not about Vijayawada Ferty9. This is about all Ferty9 branches with strict protocols. We are following the quality assurance and the control. So that is how we are able to maintain this result, and all the staffs.
Finally, you want to say something to all the Vijayawada people to, if they are facing with some kind of fertility problem and they are not willing to come outside and express their problem, so what are you going to say to them?
Like problem is a problem that can be solved, or that can be, some solution can be made only when it is opened up, or some solution we are taking some steps, so then only that could be solved, one thing. And to Vijayawada people I am telling that Ferty9 has a big pillar, that Dr. Suma ma'am is there, Dr. Suma Vaishya ma'am, our all other team, our center manager, our counselors, our embryology team, and moreover we are maintaining the transparency to the patients. And like mostly we used to tell the real transparent to the patients, and the quality control is also good. We assure that quality.
So how is the positive response of the patients?
Positive percentage is we are around 65%.
So I hope it will go to 85-95% also. So how did Vijayawada floods affect you, ma'am?
Like it affected badly only, but fine, we were able to manage.
So what are your best places to visit in Vijayawada?
Kanakadurga temple and Bhavani Island.
So you came from Chennai. So what is the difference you notice between these two states?
No, difference like, no, I have seen very nice people in Vijayawada.
Like food or something?
Yeah, food, there is a drastic change, like it is so spicy and than Chennai, but the quantity is huge here.
So do you miss Chennai sometimes?
Yeah, always. Hometown is a hometown now.
Okay, so do you watch Telugu movies, ma'am?
Telugu movies, Tamil dubbed we used to watch. Yeah.